Hello and welcome back. This is chapter 4. We will talk about pharmacodynamics in this chapter. The term pharmacodynamics, again, the pharma means medicine or a drug, dynamics means a change. So in this chapter, we will talk about what the drug does to the body. So what are the changes? So this explains the mechanism of action of the drug. It involves the effect of a drug concentration on body response. We know that individuals respond to drug differently. You can give same drug to 5 people and they will have a different response to it. We didn't know back then why you would give the same drug to 2 people and then one person will have a better result, better outcome instead of the second person. And well, now we know there's so many factors, of course, age and genetics, your ethnicity, the the overall health of the patient, and so forth. So some of the variation in the responses are due to dose response relationship, a therapeutic index, and drug receptor interaction. We are going to talk about that in a minute. So the first concept is the therapeutic index, or TI. Now, therapeutic index has to do with a margin of safety. The way I'll show you how we calculate that, but in a second. But before we move forward, let's try to define this. The therapeutic index is the ratio between the dosage of a drug that cause a toxic or lethal effect and the dosage that cause a therapeutic effect. You know how some drugs have a very fine range, a very narrow therapeutic range. There's a fine line between causing a therapeutic effect and causing a severe adverse reaction or a lethal effect. So what is the ratio? The difference would be the margin of safety. Toxic dose is TD and effective dose is ED. And when we divide the toxic dose by the effective dose, we will get TI, which is a therapeutic index. So ED50 means that's a median effective dose, is the dose that produces the therapeutic effect in 50% of the population. They calculate that during clinical trials or during preclinical trials when they are experimenting on animals. Let's say you have rats in front of you, you have 10 rats that you're doing experiment on. What amount of the drug, of that chemical, was required to produce a therapeutic effect in 50% of those rats. So if you had 100 rats, 50 rats got a therapeutic effect from that dose. That number will become ED50. Now, TI indicates the safety of the drug. We talked about that. Higher the TI, safer the drug. So, and we will see that in a minute. If the TI is small, the drug has a narrow therapeutic range and is more dangerous. The ED, the toxic, the TD50 toxic dose would be the opposite of this, by the way. That will give you the median toxic dose that will produce the lethal effect in 50% of the population. In other words, you continue to give them, those rats, you continue to give them you keep increasing the dosage until it becomes toxic. In other words, until 50% of those animals die. Then you come up with that number, that dose is dangerous or lethal. So I'm going to give you an example. Let's say you have a drug called drug X. The TD is 200 and ED is 20. Can we calculate the TI? can we calculate the therapeutic index? You can pause for a few seconds and see if you can come up with the answer. Well, the TI, therapeutic index, you divide TD by ED, and so divide 200 by 20, so the answer should be 10. Let's do another example. You have a drug Y, the TD is 30 and ED is 10. What is the TI for this drug? Go ahead and pause. All right, so the answer should be 3. 30 divided by 10 is 3. Now my next question is let's compare the TI of drug X and Y, and which drug is safer. This should be is safer. Is drug X safer than Y, or Y safer than X? Okay, the drug X is considered safer than drug Y. So the drug X had a TI of 10 and the drug Y had a TI of 3, and I told you that higher the number, better the drug, or safer the drug. All right, so that's how you calculate a margin of safety. Now, next concept is potency and efficacy. Now, the difference between potency and efficacy, these are two different things, by the way. Let's start with the definition. The potency is the amount of drug needed to produce a specified effect. How much drug do you need to see the effect? So you're comparing two different drugs, by the way, drug A and drug B. Efficacy, on the other hand, will give you what is the greatest or maximum response produced by that drug. So you're comparing the desired therapeutic effect of two drugs. What do I mean by that? Let's say that you have a drug, two drugs, let's say. So this is the concentration of this drug on x-axis, and on y-axis you have the effect of that drug. And please pardon my handwriting. I'm using a mouse to write. All right. So this is the concentration. Okay, so when you have, you're comparing potency of two different drugs, right? So here is the drug A, and then here is the drug B. So here's the drug A and drug B. Now we can say that drug A is more potent. Look at the effect here. So drug A is more potent because it requires less concentration. Here's the concentration on this axis, right? So look at the concentration of this drug. It's more. By the time, look at this concentration here for drug A. By this concentration, you already got the maximum effect here. So look how potent this drug is. And at this concentration, this drug B, has barely started to just work. So it is so behind here. So there's a huge difference between the potency. It requires a lot of concentration for drug B to match up to drug A here. So look at this effect. A lot of drug. So concentration is highest. In other words, you're considered more potent if a small amount of drug is required to produce a specific effect. So you can say drug A is more potent than drug B. So that would be potency. Now, if I were to compare the efficacy of two drugs, let's say that, so you have here same thing. Here's a concentration here, and here's the efficacy on this axis, efficacy. So now I'm going to compare the two drugs again, drug A and drug B. Here is the drug A. I'm sorry, I didn't mean to draw this way, but you got the point here. Drug A, And then here comes a second drug. Here's the drug A and here's the drug B. Now, drug A is more has more efficacy, more efficient than the drug B. This is a less. We're not measuring potency, we're measuring efficacy. So drug B is has less efficacy than drug A. So let me show you here. Oops. I have something like more information on these drugs. Potency and efficacy are fundamental concepts of pharmacodynamics that describe a drug activity. Not all drugs have equal efficacy. Drugs in same class can differ in potency and efficacy. In other words, just because the drug is more potent doesn't mean that the drug has a better efficacy as well. Those are two different things. We are really comparing two drugs for the potency and two drugs for the efficacy. All right. When two different drugs are compared, one cannot assume that the drug with a lower dose gives fewer adverse effect, and that's important to know as well. Just because the dosage is low, that doesn't mean that it will give you fewer adverse effect when you're comparing two drugs. For example, let's say you have two blood pressure medication, and let's say the normal range for this blood pressure medication is, let's say you start with 20 milligram, I don't know, and then here you have, let's say, 150 milligram. Because these are two different drugs, you cannot say that a 20 milligram of drug A will give you less side effect and 150 milligram of this drug is going to give you more because the number is high. These are not like a mathematical number. In other words, 150 is not a greater than 20 because we're talking about two different drugs. These are apples and oranges. But we still like to compare, though. You know, we need to know which drug is more potent. All right. Moving on to another topic, an agonist and antagonist. Well, anytime you have any drug that will mimic the action of the endogenous substance, we'll consider as agonist. In other words, you're going to this drug is going to work in the same direction. So if let's say if the effect of that substance was to increase heart rate, and you're taking this medication that will also mimic the same way, then you will have a further increase in the heart rate, and so forth. So in other words, you're going to have a greater response from that activity. Antagonist, on the other hand, will do the opposite. It will block the effect of that activity. In other words, it will work in the opposite direction. You know how we have like anticholinergic medication or any drug that is anti something. Antagonist means it will work the opposite. It will reverse the effect. So for example, if you let's say you took you have a patient with a morphine overdose or any opiate overdose, we can use antagonist to reverse the effect of that drug. So that would be antagonist. And there are some drugs that you don't want to get into too much detail, but there's a concept of a partial agonist or a partial antagonist, and so forth. All right, pharmacogenetics. And there are some studies that explain the role of a genetic variation in drug responses and in drug metabolizing enzyme. We always wonder why two people react differently, respond differently. Well, we know why. Remember we were talking about enzymes, cytochrome P450 enzymes in a previous lecture. We're all born with those set of enzymes that so we are kind of predisposed. How we are going to metabolize certain things. So it's all genetics. And FDA requires actually for new drugs to release that information as well, to have a section on pharmacogenetics. The goal is the future will be really have individualized therapy. This will allow customized drug therapy and so forth. All right. So what is your responsibility? Well, the main concept with the pharmacodynamics will be really to understand the adverse effect drug interaction, because we are really talking about how this drug is, what are the variables, what are some factors where the drug works differently on two different patients, and can we explain the mechanism of action? Can we explain the side effect, adverse reaction, drug-drug interaction? Can we identify those patients? Can we identify those factors? Please understand that all prescription drugs, even over-the-counter supplements, herbs, they have a potential for adverse effect because they all contain chemicals. But many adverse effects go unnoticed, especially if it's over-the-counter medication or herbal supplements. All right. We really need to know the difference between side effect and adverse effect. Usually side effects are predictable. You kind of sort of know that it may happen, and they're usually mild. Side effects are mild. They're not always a bad thing. For example, well, first of all, let me give you some side effects. Nausea, vomiting, diarrhea. Okay, so that's a side effect, right? When I prescribe, let's say, azithromycin or some antibiotic, I anticipate some nausea. So if you cannot tolerate that antibiotic by mouth on empty stomach, then let's not consider that as that you're allergic to that medication. Let's not jump the gun. Perhaps take it with small food bites, a small sandwich, whatever, to minimize the nausea. If it's a morphine, then you're really having emesis. Maybe let me give you something like a Zofran or something to minimize the side effect of morphine. Or educate, you will anticipate some loose stool. Finish the antibiotic, loose stools are expected, that's fine, as long as it's not a full-fledged diarrhea, no blood in the stool, anything like that. So let's not call that as that you're allergic to that drug. Now, so side effects are more predictable. We can educate, and they're not always deadly. And sometimes side effects we actually take advantage of side effects. For example, if the side effect of a drug is weight loss, we can maybe perhaps use that drug to lose weight. If the side effect is drowsiness, sleepiness, we can use the side effect of that drug to actually prescribe that drug in case of insomnia. I gave you an example earlier with off-label, with a trazodone or a Remeron in those patients. Okay, now adverse effect, on the other hand, are severe. They're almost, if you have to, most of the time you need interventions. Patients are hospitalized. These are your anaphylactic reactions and Stephen Johnson syndrome and so forth. One thing I want to tell you is that it is our responsibility to, when we prescribe new medication, it is our responsibility to really educate the patient when it's okay to continue to take the medication, and when do you have to pick up the phone and notify me or call 911. They need to know that. Nurses also have a responsibility to prevent, well, we talked about that, prevent adverse effect if possible. Take a thorough medication history. Have the patient to bring all the medication bottles to their first visit if possible. Tell them, bring everything, all those bags that has over-the-counter herbal supplements, everything. Adverse effect cannot be predicted. Most of the time, previous exposure to the drug is necessary, not always. Now, The adverse effect can happen to any system, and this can be entire chapter, if you will, but I'll just summarize very briefly that a drug can have effect on your liver, so that's a hepatotoxicity, on the kidneys, nephrotoxicity, on the nervous system, nerves, neurotoxic. Like you can have, numbness and tingling, like neuropathy after some drugs, like a chemotherapy can cause that. We know that acetaminophen, Tylenol, can cause a hepatotoxicity if you are increasing the dose more than 3 grams a day or so, or 3 to 4 grams a day. Most of the drugs, because they're excreted by the kidneys, they cause nephrotoxicity. And so you have to be very careful in elderly patient whose creatinine is high, or if the patient is on hemodialysis or any type of dialysis. Some drugs can cause dermatological reactions. Antibiotics and sulfa drugs can cause Stevens-Johnson syndrome. You have to be very, very careful. It's a rash. I have a picture coming up in a second if you haven't seen Stevens-Johnson syndrome before. Once you see it, you will never forget it. Drugs have a potential to cause a cardiac adverse reaction, cardiotoxicity, or musculoskeletal, bone marrow. Some chemotherapy can cause bone marrow toxicity. So you will see pancytopenia, where CBC is low and hemoglobin, WBC's platelets are low. And of course, drugs have a potential to cause harm to the fetus. These are teratogens drugs. So it's a serious business. We have to be very, very careful and educate clients about these things. All right. Here's the Stevens-Johnson syndrome. It's a rash. The patient needs to be hospitalized, of course. I've seen it with a Bactrim, or actually any medication can cause that. And that's all I have. Thank you so much. I will see you next week. All right. Thank you.